Ambassa in Tripura turns into new COVID hotspot. 27 cases reported in less than 72 hours. All cases reported from BSF's 138th Battalion at Ambassa in Dholai district of the state. While on May 2nd, 2 BSF personnel were tested positive, 12 more jawans tested positive on May 3rd, and late yesterday evening, 13 more from the Ambassa BSF camp, including 2 minors, tested positive. All the COVID patients have been admitted to the GV Pant Hospital in Agartala. The first lot of the patients were brought to Agartala from Ambassa BSF camp in special buses and ambulances. While contact tracing is still underway on a war footing in the state, the only positive thing is that all the recent positive cases are from the same spot, which makes containing the situation a bit easier, feel authorities.
তাতে একটা বিষয় নিশ্চিত হয়ে গেছে যে কোভিড-19 এর যে পজিটিভ কেসগুলো সেগুলো আম্বাসার যে বেস্ট বিএসএফ ক্যাম্প তার মধ্যেই সীমাবদ্ধ রয়েছে। আমরা এই বিএসএফ ক্যাম্পে যারা যারা রয়েছেন সবার স্যাম্পল নেব এবং স্যাম্পল নিয়ে কম সময়ের মধ্যে যাতে রিপোর্ট রাজ্যবাসীর সামনে চলে আসে এবং তাদেরকে সুস্থ করে তোলা। আর আমি বিশ্বাস করি ত্রিপুরার মায়ের এই পুণ্যভূমিতে আমরা সক্ষম হব।
While urging the people of the state not to panic, Tripura Chief Minister Biplab Kumar said that the people should follow the health guidelines issued by the State Health Department and the Centre in order to prevent the spread of coronavirus.
প্যানিক হওয়ার দরকার নেই, হয়রান হওয়ার দরকার নেই, শুধু দরকার একটা বিষয়, সেটা হচ্ছে সাবধানতা, সোশ্যাল ডিস্টেন্সিং, আর কেন্দ্র এবং রাজ্য সরকার যেই দিশানির্দেশিকা দিয়েছে সেগুলো পালন করা।
Meanwhile, speaking to Northeast Live yesterday, Inspector General of the BSF for Tripura Frontier, Solomon Yashkumar Mins, said the BSF is still trying to ascertain as to how the first jawan may have been infected. Yes, you have been taking a lot of measures, sir, but nevertheless, a certain amount of risk factor does remain. For instance, the head constable was the first to test positive in Tripura for COVID, came from Assam in the month of March 11th to be precise, and was duly put in quarantine as far as we know. But despite that, he must have contracted the virus. He must have picked up the infection from somewhere in the district, in the state maybe. So the risk factor remains thereby, irrespective of all these measures. Would you agree?
Now, if this case has come, so definitely I cannot say that he has not contracted. He must have contracted because this person, the head constable Sonowal, he had returned on 11th of March. And he had showed signs on the 24th of April, as per the record. Let us say he has started having symptoms on the 23rd evening, maybe at the most day earlier. So even then, it's there's a time lag of more than a month. In fact, it's around more than 1 month, 10 days. So we cannot say that he has not been quarantined. He must have come in contact with someone. So we are also trying to trace the contacts. We are already in the process. We have already traced the list of several people who may have come in direct contact with him because he was holding a very critical charge within the battalion. He was a battalion quartermaster who normally issues the stores and he collects the stores and this kind of stuff. So naturally, he has come in contact with these people. So that is the worry for us. So now we are also worried that how did he contact this kind of infection? Where did he get it from? So that is, of course, our concern, and we are trying to find out through contact tracing. That is yet to be conclusively established, I would say.
With 27 people getting infected in 3 days, the situation definitely is critical. While there is a sense of panic among people in Ambassa, the health authorities have called on people not to panic, but to adhere to all guidelines. With inputs from Sudeep Nath Nagartala, News Desk Report, Northeast Live.